So the vast majority of the work that we do is for our clients, and we apply a very high level of quality and care to that work. But we'll also do work for what we consider our other clients, the clients that can't pay because their socioeconomic circumstances don't allow it, and we'll apply the same level of quality to that work. It leads us to investigate other topics that obviously are related to economics and statistics, whether it is in Haiti, West Africa, poor areas of the United States.
So while at AG, I've had the opportunity to work on a few pro bono projects with health organizations in Boston. These have included organizations such as Partners in Health, as well as Boston Medical Center. So the reason I decided to start doing pro bono was because I felt like my interests really aligned with the interests of these organizations, namely doing work in health that sort of hasn't quite been done yet. There's a lot of sort of interest in using data to understand various populations or various diseases and outcomes in health, and having the opportunity to work with global health organizations to answer those questions was just something that I really wanted to put time into.
I learn every single day how to work with data, how to structure economic problems, and how to approach them. And that is really rewarding to then turn around and offer these skills that I'm developing to an organization that, say, doesn't have the resources to actually hire an analysis group.
One organization that we work with in Haiti is a HIV and tuberculosis treatment clinic called the Gesquio Centers. So for our work with Gesquio, we work with physicians in support of projects using clinical data to answer questions that they care about. So these can be questions on, patient treatment, outcomes of various programs, program evaluation. So we'll use the clinical data that they have to answer these questions for them and really sort of further knowledge in the areas of HIV and tuberculosis.
Another example of a case that I've helped work with was one where this pro bono organization promotes gardens and growing vegetables and fruits in local urban communities. And what our organization, what the analysts that I've worked with helped do was create surveys and create data sets for how these fruits and vegetables were being grown and how effective the program was from a bottom-up level.
For me personally, I have a lot of interest in global health work, so I felt that working with these organizations was an opportunity to work directly with physicians or with global health organizations. And something I've personally been really excited about because of my personal interest, but it's also an opportunity to leverage the skills that I've learned here at AG toward a sort of virtuous purpose, and also get to work on projects and manage projects myself.